We can see the slides in your PowerPoint mode. Yep, perfect now. Thank you so much. So, as I said, Deepankar is the CEO of Deep Longevity, which is a spin-out from In Silico Medicine, one of our early partners of aging research at King's. And I think what they're doing is excellent in data analytics and their algorithms for longevity data. So thank you, Deepankar. He's actually joining us today from Zurich.
Great.
Go ahead.
Thanks, Richard. And thank you so much for this opportunity. It's indeed a pleasure to be speaking with all of you here. The topic of my presentation today is psychological aging and happiness. We recently did a research, very interesting research. So I'll try and share key findings of the research in this presentation. Uh, Quick background about the company. We are a company that is creating a portfolio of aging clocks. Good to have the speakers before me already speak on this topic. So I won't spend a lot of time, except for addressing one point in the previous discussion about making this technology and what we are doing in this space truly available to people. So that is actually the goal we have at Deep Longevity. Our clocks, we hope, would be available to everyone, and we want to sort of price this really inexpensively so everybody can track and do something about their health and longevity. So a quick definition, because I'll be sort of using this term a lot in my presentation, the psychological age. We are looking at psychological age as the mental state most typical for people of a certain age group. And that is our approach. Uh, I guess we all know the scale of the challenge in front of us in terms of mental health, but I just sets the tone. And somebody told me I should put in some sources from McKinsey. It always helps in the presentation. So I put in some numbers here. So 1 in 4 people have experienced a mental health problem in England, and this McKinsey report says that about 59% people report having one mental health challenge at work. And this is really impressive that this is across regions, industries, and age groups. And the reason for that is toxic workplace behavior. And I'll sort of tend to link all of this towards the end of my presentation. But let's talk about the study that we did. So this study was on about 12,000 adults in the China Health and Retirement Longitudinal Study. We brought a combination of our aging clocks here. We brought our blood age clock. We also looked at biometrics which were available in the study, like BMI, heart rate, blood pressure. And we looked at the psychological state of the respondents. Now, some of the findings in terms of um, biological age is something that has been published in our other papers as well. And all our papers are there on our website. You can easily look it up. But what came across in terms of the psychological state was really startling. And that is what I'll share. But before actually I go there, I think this is something we can all very intuitively relate to, right? We understand that if we are not feeling great mentally, then we don't feel like doing anything, right? We don't feel like exercising or socializing, and we don't stick to a regimen or a good diet, and then invariably this affects our health. But how much, right? So this is sort of what we did in the study, right? We sort of quantified the how much part of it. And what came across was that poor psychological state accelerates aging more than even smoking does. Right? So we have talked about some of these factors before. It's good to be, from a longevity sense, more to be married than be single. And this is becomes so relevant for certain industries. For example, insurance, which gives disproportionate importance to smokers and non-smokers to realize that actually a poor psychological state is even worse. Um, so with this in mind, I'd like to talk a little in terms of the technology that we develop, and how do we then use it towards improving mental health. The premise is really simple. We have the users fill up a psychological survey And based on that, we predict psychological age compared with chronological age. And then we have set of uh, tips and recommendations prepared by psychologists that we share, um, and to sort of bring the user to a path of wellness. And this is where I think we have done some very unique work. And again, we are very open in terms of our approach and our methodologies, and that's what we put in our papers as well. So our AI algorithms have created. Let me take a step back. So if you think about mental health, it is multidimensional, it is intangible. So it's sort of very hard to measure, quantify, and then establish any sort of a baseline, right, from which you can actually chart a path of wellness, right? And that is why there's a lot of questions in terms of what really works in the real world. Our approach has been to sort of project that on a two-dimensional graph, where based on the inputs to the questionnaire, we map a person on an island of wellness, right? So in this example, the person is here, and then the algorithm calculates what is feasible, what is the next island of wellness which we can move to a person, right? And what is that unique pathway that can be offered to the user. And this is different for different people, right? In one of us could be here, and the pathway could be, the one which is adjacent to here. But the idea is that you improve and you move to a next level of wellness. We do that by mapping the psychological profile across six well-being parameters. We are looking at autonomy, personal growth, self-acceptance, positive relations, purpose in life, as well as environmental mastery. So getting the psychological age is one part, right? But then what we do is we are looking at how is that profile existing across these six well-being states. And then across these well-being parameters, the AI is recommending certain tips in terms of how you could get better. Our initial research and the study that we did, we found out that journaling helps, and there's a lot of literature in terms of how journaling helps bring out some of our hidden strengths and feelings. So we tend to emphasize on that. Sometimes it's hard to implement some of these recommendations. It might be easy for someone to say that, I should reach out to someone who I've not spoken with in the past few years, but I used to have very good relations. But it's hard to just pick up the phone and call or drop a message, right? But even to think of a name and write it down sort of moves the needle in the right direction, and that's what we are trying to do. When we are doing all this, I think it would be fair for us to admit that this is also sort of really initial stages and days for us, right? We are not claiming that we have sort of solved the puzzle to really make people well and better as a definitive solution. A lot needs to get done. We have to look at creating more engaging questionnaires. So there is no tedium when users interact with our technology. The entire concept of a psychological normal is something that we are thinking about and researching a lot, because well, I am the CEO of a startup, and my entire focus is now to build a company, and I don't really have time for socializing, and that is something that I don't think I need. I actually feed off my work. And which would be sort of different, but the same might not apply to my employees and my colleagues, right? And they might sort of have a different normal. So we'd like to kind of get into this, having that personalized normal that exists for all of us who are unique individuals. The recommendations again is something that is evolving based on those personalized normals as we establish that. And finally, the efficacy of any technology also is decided in terms of how the technology is delivered. So I think the human touch is really important, and we are thinking in terms of how to make this more engaging and interesting for the users. Some of the applications I think has already been discussed in this room, so I'll go through this quickly. The insurance industry, I think we can look at helping their customers, but also helping their core underwriting processes. The use cases around employees were just discussed. We believe, and this goes back to the topic of democratizing, and honestly, our goal long term, and I do hope that the economics allow us, is we want to make our clocks available at $1 for every user, for every prediction. And then if we're able to do this, I think this would have huge impact from a population health standpoint. And we are looking to see if we can engage with governments to bring our technology at scale and offer it at scale. The providers, of course, some of them are in the room and they understand. And for us, that's an easy conversation. And we do want them to adopt and do more and take so that they can help their patients. And finally, many platforms and softwares that exist. We are happy to. Our business model is B2B2C, so we are happy to make our technology available in a white label fashion, which could be used by other platforms or apps who are actually owning the customer and who have their customers. Finally, I think this is from me and an appeal, I guess, to everybody and all the researchers out there, because we think that mental health could be the new hallmark of aging, and our research is clearly pointing us in that direction. That brings me to the end of my presentation. Happy to take any questions. And Richard, I'm not sure if Alex